Good morning, Eastbourne. It's just Patrick here with another live from Complete Health. So I wanted to just jump on and really quickly go through a topic that really gets asked to me all the time, which is, as a chiropractor, what do you do and what are you treating? Now, what we have to understand is chiropractic doesn't necessarily treat any one condition. So the really common things that obviously most people will come to chiropractors for is back pain, neck pain, headaches, migraine prevention, and potentially control of something like osteoarthritis or just other types of arthritis. And the reason why we've basically become this stigmatized back pain and neck pain specialists is essentially the advertising agency will only allow you to advertise specifically what they deem randomized controlled studies. So say, for example, obviously we know with lower back pain and neck pain, there have been numbers of lower back pain and neck pain studies that are randomized control studies that will allow us to see that chiropractic works really, really well for lower back pain and neck pain and even headaches and migraine prevention. However, if we look at something like fibromyalgia, which is technically not a treatable disease, and something like Parkinson's, which is also not a treatable disease, but can actually have some serious benefits from chiropractic as recorded by patients. And the reason why we can't obviously advertise these things is because the advertising agencies don't deem it a treatable disease, which they are completely and 100% right. However, does that mean that we cannot improve that person's function? Well, absolutely true that we can improve anybody's function. Now, the thing we need to understand about chiropractic is that, like I say, we're not treating any one condition. We're actually managing the function of how someone's brain and nerve system starts to work. Now, if we look at the way that the brain and the nerve system actually works, a lot of its information is coming from where? The spinal cord. And that spinal cord sends information up into the brain and lets the brain know what's going on in the environment around it. So we have huge amounts of sensors. So we have stuff like our eyes, our ears, even stuff like our tongue so we can taste. We have the sensors in our fingers. We even have sensors in our muscles that will tell us when we're stretching too far or leaning too far or bending too far. And we even have sensors in the discs, same thing. This tells us where our balance and our coordination and all these other things are. Now, if there's a problem with the spinal column and it affects the way that the spinal cord works, is it safe to assume that anything that the spinal nerves actually control can start to go wrong? And I'll just let that sink in for a second, because if we actually look at what the brain and the spinal nerves actually control, the brain and the spinal nerves actually control all functions of the human body. So if the brain and the spinal cord are not working the way that they're supposed to, is it safe to assume that we will start to see diseases manifest? Now, what we know about stuff like Parkinson's, what we know about stuff like osteoporosis, what we know about heart disease, what we know about pretty much any disease on the planet, there are a few things that are starting to go wrong. There's a level of inflammation that's not being controlled, and there's a change in that person's function. Now, if we start to change that person's life, we're not necessarily treating any one condition, we're improving the life of that person. Say, for example, if we improve someone's diet, is it safe to say that we'll actually see improvements in that person's heart function? Is it safe to say that if we are working on exercise, we'll see improvements in people's heart function? You're absolutely right. We'll 100% do that. Is that chiropractic? Well, 100% is chiropractic, because chiropractic is a holistic therapy that's going to look at the chiropractic care and the lifestyle of that patient in order to actually improve their health. So are we treating any one condition? Absolutely not. What we're doing is observing what people are doing in their lives, the changes that they're making, how they're damaging and detrimenting themselves, and then what things we can actually do to improve that. So if we can improve someone's inflammation, will we see improvements in their headaches? If we can improve someone's diet, will we see improved bone density? If we change someone's lifestyle, if we change the things that are going wrong, will we start to see improvements in people's health? And so what we've got, like I say, the question we've got to ask is, what are we treating? Well, we're not treating anything. we're managing the way that the nerves and the brain start to work. And as the brain and the nerves and the function of those joints start to improve, people's inflammation starts to go away. As people's inflammation starts to go away, people feel more comfortable, they're in less pain, they're less irritable, their thought processes start to change. People's diet starts to change, further improving the recovery process. These are all ways of starting to improve your health. But are we treating any one condition? Absolutely not. We're improving the function of that person. And as a result, what we start to see is healing starts to take place. And as healing starts to take place, all of these conditions that people have been living with for such a long time start to change. So, by the way, guys, if you don't know what chiropractors do, talk to one. They are almost always happy to talk about health. It's basically the reason why they became a chiropractor, because they love engaging in conversation about actually improving people's lives. We're here to help people. So whether that's for big problems, small problems, we're here to support you. So just to rectify, chiropractic doesn't treat any one things. We are allowed to only advertise certain things based on randomized control styles. So this is exactly the same as medicine. Medicine is allowed to throw out loads of prescriptions that are basically duff because they've twisted the results. But because there's randomized control style trials, that makes it okay. That makes it okay. And again, I'll let that sink in for a second. And if you want to learn a little bit more about the pharmaceutical companies and how they twist their therapies to make it all fit, there's a brilliant book by Ben Goldust called Bad Pharma. And it's not all medications, by the way, it's just some. But like I say, chiropractic, all about improving lifestyle function. And as a result, letting the body do what it does best, which is heal itself. That's all I'm going for today. If you guys have got any questions, just post them in the comments below. Equally, if you want to listen to more of our content, we are on Spotify and iTunes. We're there as Coffee with the Chiropractor on Spotify and iTunes. And if you want to try and find the repeats of these videos, any of the videos that we've done in the past, majority of them are saved on YouTube, and our YouTube channel is Complete Health Eastbourne. Nice to speak to you guys, and we'll see you again tomorrow.